This content is AI generated for informational purposes only and should not be directly used for clinical decision-making.
Hello and welcome back to the Neurosurgery Hub podcast. I'm Dr. Eris, Senior Attending Neurosurgeon.
And I'm Dr. Alara, Research Fellow. Today we're looking at a fascinating new study from the journal Seizure, published in 2026. It is titled, Well-Preserved versus Severely Impaired Memory, 10 to 44 years after temporal lobe epilepsy surgery. How did the patients get there?
This is a significant title, Ilara. In our field, we are often focused on the 1-year or 2-year follow-up, but this study looks at a horizon of 10 to 44 years. For a resident or a practicing surgeon, that time frame covers nearly a patient's entire adult life.
It really does. The study specifically aimed to identify the factors influencing these ultra-long-term memory outcomes. The researchers weren't just looking at the average, they were contrasting the extremes, patients with well-preserved functioning versus those with severe impairments.
The central question of the paper is essentially the subtitle, How did the patients get there? When we see a patient 40 years post-resection who is struggling with severe memory deficits, we have to ask if that was an immediate surgical consequence or a slow attrition over decades.
Exactly. And for the medical students listening, it's important to remember that temporal lobe epilepsy surgery is often elective and focused on quality of life. Understanding who will maintain well-preserved functioning over 4 decades versus who might end up severely impaired is the holy grail of surgical counseling.
Let's dive into those factors. The study focuses on what differentiates these two groups. When we think about the temporal lobe, we're balancing seizure freedom against the risk of damaging the hippocampal structures. What does the study highlight about that journey?
The paper emphasizes that the long-term memory outcomes are not static. By following patients for up to 44 years, they could see the divergence in trajectories. They focused on identifying factors that pushed patients toward one of these two poles.
In my experience, we often talk about the surgical hit, the immediate post-operative drop in memory. But this paper suggests we need to look at the how. Is it the underlying pathology? Is it the seizure burden over those 40 years? Or is it perhaps the side of the resection?
The study really forces us to look at the severely impaired group and ask if their decline was preventable. For the practicing neurosurgeons out there, this data is vital because it shifts the conversation from will you be seizure-free to where will your memory be when you are 60 or 70 years old.
It's a sobering perspective. If a patient is 10 to 44 years out from surgery, they are also dealing with the natural aging process on top of their surgical history. The study's focus on well-preserved patients gives us hope that a high level of cognitive functioning is sustainable long-term after a temporal lobe resection.
Right. It's not a guaranteed decline. Some patients stay well-preserved. The how did they get there aspect of the study is really about identifying the protective factors versus the risk factors that lead to that severely impaired state.
This is essential for our residents to understand during patient workups. We aren't just looking at the MRI and the EEG for the next 6 months. We are looking at the next 40 years.
It also highlights the importance of longitudinal neuropsychological follow-up. You can't answer how they got there if you only see them at year 1 and year 40. You need the data points in between to see that trajectory of memory outcomes.
Precisely. This study in Seizure provides a much-needed long-term lens on TLE surgery. It reminds us that our surgical decisions have echoes that last for nearly half a century.
It's a powerful reminder of the responsibility we carry in the OR. If you're interested in the specific data points on these memory trajectories, I highly recommend reading the full text to see how these factors weighed out over the decades.
Thank you, Alara. And thank you all for listening to the Neurosurgery Hub podcast. We'll see you next time.
See you then.